back, welcome back, welcome back. Well, the question for today is, which instruction would the nurse include when developing a teaching plan for a client being discharged from the hospital on anticoagulant therapy after having a DVT? Select all that apply. Now, in this question, we have no diagnosis, so it's best to approach this question by the topic, subject, and action. So for this question, the topic is anticoagulant therapy. The subject is DVT, and the action is instructions for teaching. So what we need to do is we need to write down what we know about anticoagulant therapy. List some things you know about anticoagulant therapy right now. List something you know about the subject, which is DVT. What do you know about DVT? Go ahead and list it. Now, let's try and pick out, select all that apply, based on what we know. I'm not going to mention what my topic is or my subject is because it might be different from yours. But let's go ahead and answer the question. Choice 1, checking urine for bright blood and a dark smoky color. Choice 2, daily walking as a good exercise. Choice 3, using garlic and ginger, which will decrease bleeding time. 4, performing foot-leg exercises and walking around the airplane cabin on long flights. 5, prevention as the best treatment for DVT. And 6, avoid surface bumps because the skin is prone to injury. So my choices were, I'll explain my choices and why I picked them, and then I'll read the rationale. My choices were checking urine for bright blood and dark smoky color. I picked that because although I know that anticoagulant therapy, DVT, be careful with the bleeding, I picked one because bright blood and dark smoky color. It was very detailed as an answer. I always pick detailed answers, right? I picked 2 because daily walking as a good exercise. That's true. Walking prevents emboli, right? I did not pick 3. Using garlic and ginger will decrease bleeding time. No, if anything, it will increase bleeding time. Garlic and ginger are natural blood thinners, so I did not pick that. Number 4, performing foot-leg exercises and walking around the airplane cabin on long flights. I picked this because it prevents emboli. 5, I did pick prevention as the best treatment for DVT. And 6, I did pick avoid surface bumps because the skin is prone to injury. People that are that have DVT and are on anticoagulant therapy, once they get an injury, it takes a long time to heal, right? Because of the increased bleeding time. So I picked 6. So these are the reasons my choices were 1, 2, 4, 5, and 6. Now let me read from the book as to why the book says the answers are right. Answers 1, 2, 4, 5, and 6. Rationale. Clients with resolving DVT being sent home on anticoagulant therapy need instructions about assessing and preventing bleeding episodes and preventing a reoccurrence of DVT. Blood in the urine is often one of the first symptoms of anticoagulant overdosage. Fresh blood in the urine is red. However, blood in the urine may also be dark and smoky in color. Daily ambulation is an excellent activity to keep the venous blood circulating and thus to prevent blood clots from forming in the lower extremities. The herbs garlic and ginger increases bleeding time and should not be used when a client is on anticoagulant therapy. Clients who have had previous DVTs should avoid activities that cause stagnation and pooling of venous blood. Prolonged sitting coupled with change of air pressure without foot and leg exercises or ambulation in the cabin are activities that prevent venous return. Instructing the client about prevention measures is important because clients with DVT are at high risk for pulmonary emboli, which can be fatal. The client can be taught risk factors for DVT and PE. In addition, recommendations for prevention of these events also are standard protocol in practice and should be shared with the client for home care purposes. Older adults should be monitored closer for bleeding because the skin becomes thinner and the capillaries become more fragile with the aging process. And that is the book diagnosis as to why the answer to this question was 1, 2, 4, 5, and 6. Okay, guys, thank you. I'll see you in the next video.